Good to go. Okay, awesome. So Dr. Brandon Lundell, how you doing?
Good. How are you doing?
Good. Thanks for joining me today. This is a different podcast. We're doing this one remote because you live in Denver, right?
Yeah, thanks for having me.
Absolutely. So we met last, I guess earlier. No, it was last year, and you were at a. Essentially, we ended up at the same place. I was there because I own a marketing agency, and I was looking to start working with more chiropractors. And you were there because you were the actual speaker who
Hmm.
was training the doctors.
Yeah, yeah,
So
that was a good
how
picture.
tell me a little bit more about how that works and what I guess more about your business model in terms of the things that you do for your business.
Yeah, sure. So I've been doing functional medicine for about 15 years now. I've been in practice for about 15 years. I practice just outside of Boulder, Colorado. So it's a great place to be. And yeah, just I think I got into this a little bit different than a lot of people. I was actually graduated graduated from CU Boulder and was headed probably to law school and did an internship at a law firm and took a year off and started having some of my own health issues. And at the time, I was working at a bookstore, and I just started reading some books, and I came across a book from a naturopath, and it was just one of those moments in life where it was kind of an aha moment. I still remember it to this day. I remember the exact chair I was sitting in reading this book, and it kind of hit me like a ton of bricks. Like this, I want to know everything there is to know about how the human body really works. The book was talking about diet, and this is 20 years ago, so more it's kind of newer back then, but talking about candida and how diet affected the the microbiome, and talking about that and how the gut affects overall health, and just recipes that were and this was new to a college kid, and the college kid thinking that what I ate didn't really matter. And so I kind of looked at all my different possible avenues. I looked at, traditional medical school, looked at naturopathic school, looked at chiropractic school, and I actually didn't, I didn't want to prescribe medications. I knew from day one I wanted to do holistic natural medicine, but to use the best of Western medicine as well. Naturopaths is great training. Naturopathic school is great training, but at the time they weren't licensed in Colorado. In fact, they only got licensed here in Colorado a couple years ago. So I didn't want to go through 4 years of school and then not have a license
Mm-hmm.
to practice anything. So, and again, medical school, I was actually on track to go to DO school. And so I narrowed it down to DO school and chiropractic school, and I happened to come across a chiropractor who was very holistic, and he did homeopathics, and he did all kinds of detox and training, and I had just, as the universe does sometimes, kind of nudges you in the right direction. I had actually I was fishing in January on a river up here, and I slipped and fell on the ice and tore a lot of my SI joint ligaments,
Mm.
and so I started seeing this chiropractor who really opened up. Like, yeah, this is how I want to practice. I mean, and he was treating everything from diabetes to musculoskeletal, conditions, and he was, an acupuncturist as well. So that was a real, he was a big kind of role model and mentor early on. So I decided to go to chiropractic school so that I could treat the whole body, not just biochemistry, but the physical piece. And I honestly, anybody with enough training can be really good at functional medicine. But I've always been about the whole body and treating the whole person. And so it's nice to have that skill to be able to do musculoskeletal medicine on top of the biochemistry and internal medicine. So from day one, a lot of chiropractors get into functional medicine after being somewhat well, and medical doctors and nurse practitioners too, they get somewhat disillusioned by, just the limited amount of information and knowledge that we learn in school to really help people. So a lot of times they get into this after school. Well, fortunately, I knew this is the direction I wanted to go in school. So I always kind of joke that it made me pay attention more in school,
For sure.
like, biochemistry wasn't just something to memorize and get out of the way for boards. It was, I'm going to use this in my practice one day. And so I was doing a ton of training. I took advantage of the old student discount, so when you're a student, all kinds of postgraduate seminars and trainings are usually half off. So I went crazy. While I was in school, I did my acupuncture and Oriental medicine diplomate. So that's a 3-year diplomate. I started doing endocrinology training for the National Institute of Endocrinology. And so I got a lot of naturopathic and endocrinology training through that. And I started doing blood work, functional medicine, functional blood chemistry right away. And then I went through the chiropractic internal medicine program. Again, it's a 3-year diplomate program, and that was really a good, well-rounded program. It went into blood chemistry and everything from pediatrics to geriatrics and everything in between, and cardiovascular and detox and endocrinology. And I actually teach for that. If you go to the website, or if you Google the American Board of Chiropractic Internists, that's a good training and a good program there, and I teach for that as well. And I went through the Institute of Functional Medicine training as well. I was the first chiropractor to be certified through the IFM, and I've just been to hundreds and hundreds of seminars. And I started teaching about 10 years ago, started putting all this together and seeing that, there's a big gap. I mean, a lot of people sort of dabble in functional medicine, but I'm really passionate about making sure people do it correctly, because it ultimately gives holistic medicine, natural medicine, functional medicine, whatever you want to call it. I call it functional and integrative medicine, because I do truly integrate a lot of Western medicine with it. To me, it just should be called medicine. And to me, it's just how it should work. You should use natural therapies when appropriate. You should use medications when appropriate. And so, however you want to call it, it gives it a bad name if you're not doing it, with best available evidence and thinking critically about what the true causes of illness are. So that's just a little bit about my background. In terms of my business model, I kind of go on a pro rate. I just do an hourly rate. And so, I've got a busy practice, always have. One-on-one is always important to me. I teach a lot, but I don't think I'll ever give up clinical practice. I really enjoy putting all this information into practice and helping people one-on-one, and just seeing the change, and
That's a great way
helping
to stay.
people avoid.
That's a great way to stay sharp
Yeah,
too, because when you're
it
applying
is.
it, that's when you're going to get the most out of that. I think as a teacher, I
Yeah.
heard someone say, if you really know a topic, you can teach it. If you don't know a topic, you can't teach it. So it's a great way to find out all the knowledge gaps that you have.
And to see what really works. I mean, it's one thing to read studies, which I do, and that's, I made a commitment in school that for my entire career I would always read, at least 2 studies a week, and then that
Wow.
turned to like 20 studies a week. But yeah, I've kept that commitment, and it's a great way to stay sharp. And then, yeah, like you said, what really works, and applying it to an actual patient. And again, it's one thing to have the knowledge, but you do have to be able to communicate that with the patient, and have a business model, and have a practice model that helps the patient succeed. Because ultimately, you can give them a ton of information, and and send them on their way, but they need to be set up for success, and that's really a big piece of what I do.
Awesome. So, one of the questions I have for you is, when I try and explain to someone what functional medicine is, that ends up basically the way I explain it is functional medicine. When you go to a doctor, the thing that bugs me about a doctor is that you go in and it feels so rushed, so hurried, and the only thing like this is almost a real conversation. It's very close to the real conversation I had. I went to a doctor and I told her I have some back pain. She said, "Okay, have you ever taken a muscle relaxer?" I was like, "Yeah, I've taken Flexor." "Okay, I'm going to get you a prescription of." I mean, she didn't even let me get to the point of answering a question before she's already starting
Yeah.
to tell me this is what we're going to do. And the
Mhm.
difference in my mind anyway between a traditional MD doctor and functional medicine is that functional medicine is more of where we sit down and you're saying, okay, well, you have some back pain. When did that start? Well, it started here. And, was there anything related to that? And you're really trying to, instead of just trying to diagnose the symptoms and figure out how to make them go away, instead you're really trying to get to the root cause of the issue. At least that's the way it feels to me. How would you describe functional medicine?
Yeah. So, I mean, that's a good point and a good question. There's no standard definition of functional medicine, but there's no standard definition of Western medicine either. So,
Mm-hmm.
um, I think that the way I describe it is, yeah, functional medicine asks three questions. Like a good functional medicine doctor should be able to answer three questions. Okay, so if you come in and you have a symptom, the first question you have to ask is why. And right there, that's deviating from the Western medicine model because Western medicine will just, traditional medicine will just say, all right, what's your symptom and then what drug do we need to, or what therapy, which is usually drugs or surgery, is appropriately applied to that symptom. So the first thing we do in functional medicine, or I do, and I teach my students, is why you have low back pain. Why do you have low back pain? Is it arthritis? Is it an acute sprain strain? Is it if it's arthritis, so say, okay, we make a diagnosis, we do an X-ray or something, and it's arthritis. So then the next question is why? Why do you have arthritis? Well, it's an inflammatory condition. It's not a normal condition of the body. There's wear and tear. So then you ask, well, all right, are your core muscles weak? What contributed to abnormal wear and tear, and then what systemically contributed to the inflammation in the body. And we know that osteoarthritis or arthritis is actually a lifestyle disease. So what in the lifestyle? Being sedentary, not exercising correctly, and we know leaky gut contributes to a rise in systemic inflammatory chemicals like tumor necrosis factor alpha and interleukins that will cause abnormal wear and tear and cause joints to break down prematurely. And so then we ask, okay, then you've got osteoarthritis. Then we ask why. So there's three questions that minimum. And if you answer those three questions, and why, then you start getting at the true causes, as you say, or root causes is another sort of, common term. You start getting at the real biochemical aspects, what's really happened on the cellular level that needs to be addressed and changed.
Mm.
So that's the big difference. So you can do that with anything. I have hypothyroidism. Okay, why do you have high? I mean, you do have to make the right. You first have to use the right tools to assess the symptom and blood chemistry and your physical exam and history. But then you have to go deeper.
Yeah. Which I feel like that's the part that's missing from a lot of Western medicine, as it really is. And I think, a lot of it's due to the fact that there's not enough doctors, but you have this, and chiropractors
Mm-hmm.
are guilty of that as well, where they're really trying to just rush people through the process. rather than actually treat the symptoms. So I love how you approach
Totally.
that in that same way, where it's just let's figure out what this bottom issue is and fix that. But yeah, it
Yeah,
takes
and
it takes a lot
people,
more work too.
it takes more work. It takes more training. And look, there's no diagnosis code for asking those questions. There's no diagnosis code, or there's no CPT code. It's very difficult to incorporate this into the modern insurance industry, and so yeah, doctors are forced to spend 10 minutes, 15 minutes at the most with patients, and we forget that a huge therapeutic benefit to the doctor-patient relationship is the doctor spending time and listening to them. And in fact, one of my books that I give to my patients is a book by Herbert Benson, who's a Harvard-trained cardiologist who's done, 4 or 5 decades now of research on the health benefits of what he calls the relaxation response, and he's got a good book called Timeless Healing, and when a patient feels supported, that hey, I found someone that's really going to figure this out for me and fight for me and be on my side, that triggers hormones and chemicals in the body that produce more healing effects than any drugs, any supplements. Like, we forget that just the healing nature of the doctor patient relationship is tremendous. And that's why every study ever done about patient satisfaction, the number one criteria is just, did the doctor listen to them and spend time with them? And so my patient visits are usually, even if I'm doing chiropractic work, which I often do with my patients, because I do see even preventatively the benefit of getting, soft tissue and chiropractic work. And, that I just enjoy doing that. So, but the average patient visit is about 45 minutes, to an hour.
Wow. Yeah, that's significantly more than the average, I would say.
Yeah, I mean, the average chiropractor is about 5 minutes, and the average medical doctor is about 10 minutes. So yeah, we try to fit a lot into each visit.
That's incredible. The last conversation I had with my doctor was about back pain, and it was funny to me because she said, what do you normally do for your back pain? I said, well, I see a chiropractor, but right now I'm in between chiropractors, and that's why I'm here. And I'll be honest, I was actually looking for muscle relaxers at that point, just because if I can't get into the chiropractor, that's the next best thing for me when my
Yeah,
back does tighten up. So, and I didn't, I was in between chiropractors at the time. So
right,
I said, she said, well, I don't believe in chiropractors. I said, you don't believe in them? Like,
right,
like the Easter bunny? Cause I've seen several of them. I
right.
can tell you they exist.
Yeah,
and
exactly,
and she said,
exactly.
well, let me ask you, when you go to the chiropractor, how long does that treatment bring you relief? I said, well, normally about, maybe 2 weeks or so. And then my back starts to get kind of tight again. I like to work out a lot. I like to do a lot of exercises. And that does I'm not really good on the stretching side. So that tends to bring a lot
Hmm.
of tightness for me. And she said, well,
Yep,
2 weeks, that's it. And I was, I was kind of frustrated. So I was being a jerk, to be honest. But I said, I
sure,
don't understand what you're saying. You're telling me that, muscle relaxers, they bring relief for like 2 hours, and the better solution than
exactly.
chiropractic is just to stay on
Yep.
those every 2 hours.
Yeah,
So,
yeah. You do. You get to see. There's a lot of biases, and I don't want to take our time and go into the big history, but the AMA, the American Medical Association, was actually sued by a couple of chiropractors back in the 80s for racketeering, and
hmm,
racketeering is where you systematically um, uh, put out falsehoods to destroy your competition, and so it's a big study. You can Google it. It's called Wilkes versus the AMA, WILKS, and went all the way to the United States Supreme Court, and the AMA was found guilty of racketeering, and they were doing things back in the 50s and 60s like going to high schools and telling guidance counselors that chiropractors kill people, and
Wow.
that it's an unscientific cult. And they would put ads out in the paper that, false ads, that this person died from a chiropractic adjustment. And we see it today with strokes. And, to this day, not one scientific study has ever associated chiropractic adjustments with strokes. But that's a very big pseudoscience, tactic by the AMA and other, established medical groups that still want to, and how they put it was contain and eliminate the chiropractic in any other profession. They tried to do it that was a direct competition with them. They tried to do it with osteopaths, and they gave osteopaths the choice, because osteopathic medicine back in the 40s and 50s was very similar to chiropractic, just using manual medicine and the healing power of touch, and they offered both chiropractic and osteopaths, said, hey, well, if you adopt all of our training, you can, we'll leave you alone. And so the osteopaths chose to take it, which is why, DOs are still, are kind of, into the fold, traditional medicine fold. But chiropractic's always been, they were throwing chiropractors in jail, in the 20s and 30s for practicing medicine without a license. So anyway, there's been a long-standing feud, and I can go more into it. Goes back into the Carnegie days, where Carnegie actually, got patents on all the medicines and wanted to, basically make Western medicine or pharmaceutical medicine the only legalized form of medicine in the country. So
Wow.
yeah, so you go to a traditional medical doctor, and in my classes I go through that look, my patients tell me I'm more of a Western medicine doctor than their Western medicine doctor, because I want to know what's really going on. So nothing that I say is anti Western medicine. I don't believe the feud needs to exist on both sides. We can coexist quite peacefully and to the benefit of our patients and society. So, nothing I say is against Western medicine, but even the Institute of Medicine, which is the watchdog of Western medicine, says that 80% of all diagnoses in Western medicine are wrong. When they go back and look at charts, they say, that the doctor never made the correct diagnosis. Low back pain is not a diagnosis. It's a description, of a symptom.
Sure.
So to make a diagnosis means, and the word diagnosis means to see something through. Dia means like diameter, the whole thing, and gnosis means to know. So diagnosis means to see something clearly from all angles. And so, we're not making correct diagnoses. And the number one reason actually that they point out, interestingly enough, and I can, send people that article if they want to, or they can look it up, but it's actually the lack of knowledge by physicians of the correct laboratory tests to run. And laboratory medicine is one of my passions. I love laboratory medicine. What is really happening? Blood chemistry doesn't lie. I want to see it. I want to see what's really happening in the body. And so it's really exciting right now in this day and age, because the amount of laboratory tests that we have available to us are phenomenal, and it takes a lot to learn. But I had a patient not too long ago who, had symptoms. She was, she had diarrhea and fatigue, and she was admitted to the hospital, and they ran tests for like Giardia. Our Western model is too myopic. It's just, let's just look at the symptom and not look at the bigger picture. And, she spent 2-3 days in the hospital, was never given a diagnosis. She was given a $30,000 bill.
Jeez.
And she finally came to me and said, what do you think's going on? I mean, I'm still fatigued. They didn't help me. And I just asked her some questions, and all the symptoms started after she got back from a rafting trip from Montana, and so I'm thinking, okay, maybe there's some infectious disease here going on. So I ran a Lyme and West Nile, and sure enough, it was West Nile, and it was an acute. It was IgM. Antibodies were high, which tells you that it's a recent infection, and so we treated it naturally with the natural medicine, and with we did lysine. I can give people my protocol, but you got to make sure your methylation is working well for viruses, and you have to make sure natural killer cells, and with it, and we had to repair her nervous system with things like alpha lipoic acid. But within 3 weeks, she was great, and there was no doubt in my mind that would have progressed into encephalopathy, which is often what kills people with West Nile, because it was starting to head in that direction. And Western medicine, doesn't really have anything to offer for Tamiflu, for viruses. So alternative and functional medicine, we have a ton of tools when it comes to immune support. So that's just one example of how functional and integrative medicine can work.
Mm-hmm. I like what you said about medicine and naturopathic should not be separated in terms of the way we think about things. Instead, it should just be called medicine. That makes a lot more sense to me as well, because, I mean, if you have the tools at your disposal, why not use them? And if they work and they're effective, then consider them as options. And if they're not, then just leave them off the table. Because there's a lot of things in traditional medicine that just don't work, and there's doctors that exclude that in their practice. Likewise, if there's things in your practice that and the thing that's awesome about your practice is that if it works, you use it. If it doesn't, you don't.
Yeah, and it's again, not to get into too much of the politics of it, but there was a study done recently, in the last 5 years or so, published in the Journal of American Medical Association, and they asked the heads of all the departments in medical schools, traditional medical schools, if they had a financial relationship with pharmaceutical companies, and most of them admitted to a financial relationship with pharmaceutical companies. And then one step further, if you go into who writes the textbooks and who develops the curriculum, it's very much pharmaceutically influenced, and that's not necessarily a bad thing in and of itself, but it is too one-sided. And so you go to your medical doctor, and of course they're going to just give you the standard spiel that they learn in medical school, that supplements are unregulated and they're potentially dangerous too, and chiropractic is ineffective, because they simply didn't get any objective training, any objective learning. The curriculum that is laid out for them and the textbooks that they're learning from are all pro-pharmaceutical. And so why would a pharmaceutical company, write in their textbook that, hey, if you lower homocysteine through B vitamins, the person's going to have less of a chance of developing cardiovascular disease and Alzheimer's and dementia, when that's taking money out of their pocket directly, because you're essentially taking patients away from their model. So, that's just the cold hard facts of how our medical system is and how it works.
Yeah, that's unfortunate too, because it's at the detriment to us as people in terms of our overall health. I have my best friend actually is a doctor, an MD, and he works as a pediatrician, and he was the one who introduced me into chiropractic. I mean, we were young. He wasn't a doctor at the time. But he's
funny.
One of the things I love about him is very much where he's open to different ideas, different concepts. He does tend to be fairly closed-minded when he comes to a conclusion on something, but up until that point, he's very exploratory, and it's just it makes him a good doctor as well.
Right. And I often tell people, I mean, a lot of medical doctors have come to my classes, and so there's two things that I've noticed. One, to break out of that system, very few people like very few people go through traditional Western medicine, training for 7 years, and with the idea in mind that you're going to do natural medicine, because that's a hell of a commitment. That's $250,000 or more in 7 years of your life, essentially learning things you're not going to use, right?
Yeah.
You're just getting a degree, but you're not going to use pharmaceutical medicine as your first line of therapy. And so a lot of medical doctors come to functional and integrative medicine through either a personal or family tragedy.
Mm.
They realize that Western medicine has gaps, and Western medicine has failed them. And again, Western medicine is great. It saves people's lives, and all medications have their place. I am not anti-medication, but it is the cart before the horse. We should try natural medicine therapies that have been proven, that have scientific evidence behind them first, because of the lower side effect profile. And if you think about it, that's really the Hippocratic Oath, to do no harm, if you've got two therapies that essentially work the same. One of the studies I use as an example is SAMe and depression. SAMe, when studies, placebo-controlled randomized trials, which is the gold standard, and medical doctors won't listen to you unless you have a placebo-controlled randomized trial to pull out of your hat. And oftentimes they will say, they'll give a blanket statement like, well, supplements have never been studied. Like, how can you say that? There's hundreds of thousands of placebo-controlled randomized trials that are very well done and have good evidence behind them. And I often tell medical doctors that the greatest scientific, and nurses too, like anybody who's, new to functional and integrative medicine and maybe skeptical, but uses the science card, right? Uses that, well, it's not scientific. So I often say, well, the greatest, and I can't remember who said this. I think it was Paracelsus, a Greek philosopher and scientist. He said the greatest, and I could be wrong about that, but it's somebody who's a famous scientist. He said contempt prior to investigation is the greatest scientific error. Mm-hmm. And that's unfortunately what we're seeing is all of these medical doctors, not your brother, but he was open to it more, to get out of that model of just automatic knee-jerk, now that's a bunch of crap. And there's an arrogance to it too. Like, hey, if that was really real, if that was true, and I actually had an oncologist tell me this. I was telling him about, dianomethane and breast cancer research and things like that. And he said, well, if that was really true, I would have heard about this in school, or I would have heard about it in all of my, seminars and symposiums I go to. These are the best and brightest minds. And I just asked him, I said, well, that's great, but who puts on those symposiums and seminars? It's the pharmaceutical companies. And he admitted, he kind of never thought about that. He's like, you know what? You're right. All of my information is being filtered through, and that was enough to change his mind. And he said, well, you know what? All right, maybe, he got to the point, which I thought was great. He said, well, all right, well, let's try some dianomethane, and maybe we can use less, of the medication, tamoxifen, and
Very
other things.
nice. What a good doctor.
He's going to do. What's that?
What a good doctor. Yeah, I like that he was willing to change his position based on new information that had come in.
And that's why I never make it personal. Like I don't hold, like your doctor, who's just poo-poos chiropractic. Like I have more compassion for them. I mean, it's still annoying, right? But mm-hmm. It's still killing people and hurting people, unfortunately, their lack of knowledge. But I do have more compassion for them because they're good people. They're trying to do the right thing, but they just got a ton of misinformation. So I try to have a little more compassion. But back to my SAMe point. So studies showing SAMe and head to head with, with other SSRIs or other antidepressants shows SAMe working just as good without the side effects. That should be taught in medical schools, and it's starting to actually in some medical schools like CU Boulder to say, hey, why don't we try the natural therapies first? Because the side effect profile is so huge and so potentially devastating with pharmaceutical medicine that, what have we got to lose? And sure enough, people get a lot better. But then we just hit up against that. Well, it's not covered by insurance. And so who is this going to be available to? And, unfortunately, it's people with means, with the will and means for it, which is a whole nother topic.
When I started my business, so I started this business in January of last year. So, and I had worked for the same company before that for 10 years, had a really large team that I was working with, a very solid network. And I switched from, this very secure job where I'm in a community and everything to, really none of that, and starting over, setting up a business. It's very, very lonely in a lot of ways. And
Yeah.
there's a lot of work to really do it well. So and then the worst thing, and this is what actually I found out for me, was I took off some time from working out so that I could focus more on the business. And that was the worst decision I made, because for me, I have to work out. It gives me a lot of mental energy, and it really keeps me in a very positive place. But I started to deal with some depression at that point. So I went to a doctor and I told them, I'm dealing with this. They said, well, I'm going to prescribe you this SSRI, and it's completely safe. There's no issues. And I said, great. I went, I fulfilled the prescription. It was like $5 for this 1 month supply. And I got home and I did what I do before I take anything, which was, I'm going to do my own research now. And I found that, I can't remember the name of the one that they prescribed, but it's awful. And when you try and get off of them, if you've been on for any more than 1 or 2 months, you can actually get what they call brain zaps, where you feel like this little zap in your head as you're, you're detoxing. And what I found is that can actually be a permanent issue on top of that. And so that immediately destroyed any trust that I had with my doctor at that point, saying that this is safe, there's no effects, versus, I'm seeing lots and lots of people who were having issues with that. And then what ended up happening is I decided not to take those. So I did not even take one pill, but I started working out again. And within 2 weeks, I was back to my normal self. I had lots of energy. All of that crap just went away. And all I had to do was start working out again. So it was unfortunate to me that, you talk about 80% of diagnosis are incorrect. That was certainly, maybe that was a proper diagnosis, but it certainly wasn't a good treatment path, at least for me.
Well, exactly. And again, medications have their place, but for somebody like you would have been a perfect candidate to say, well, let's try these, alternative things first. And again, if that doctor had in his mind why, if he actually asked the questions he should have asked, why are you depressed? Okay, is there somewhat situational, and how can we, get you to, reconnect with people again in a meaningful way? Because your job is now a little isolating, and then you're exercising. Let's get the blood flow. Let's get the nutrition back going. And then again, what are the supplements that might be helpful short term? And the treatment model. So I've got the diagnosis model of asking the whys. My treatment model is it's an overused analogy, but I use the 3-legged stool analogy. And the reason why I use that is because if one of those legs isn't there in the treatment model, and what you're offering patients, then the whole treatment plan is probably going to fail. And so the simplified version of that is diet, lifestyle, and supplements. And you can't sort of make 2 out of those 3 legs stronger and expect that stool to keep standing. All 3 of those have to be there. So, I would have questioned you on your diet. I would have had you fill out a food diary And we know a lot of depression comes from the gut and the gut brain axis, and saying, all right, what foods were you maybe eating at the time that was potentially feeding bad bacteria? Or do you potentially even have dysbiosis or a lot of what we call gram-negative bacteria that start secreting chemicals, every time you eat, called, such as lipopolysaccharides that will go into the go into the blood system and cross the blood-brain barrier. And we know how this works, and it triggers microglial cells, and it literally affects how your synapses work. And so this is where we start getting into the why. Why are you depressed? What are all the reasons that you might be experiencing that symptom? So I might have then done a stool test if I had seen that your diet was off a little bit, and we would have, discussed, what a good anti-inflammatory diet. And there's this whole body of research called the inflammatory hypothesis of depression, and how it's the inflammatory chemicals and xenobiotics, we call them, which are chemicals from, foreign microbes like our gut microbiome or infections that trigger, depression. And many researchers believe 80 to 90% of people with depression, clinical depression, it's systemic inflammation. And so then you have to ask, all right, why? Where is that systemic inflammation coming from? And then I would have, absolutely, lifestyle is essentially exercise, sleep, and some kind of meditation or mindfulness, or some kind of mental health activity that's supportive, yoga, something like that. And I would have instructed you on how to reincorporate that. And then you would have said, well, I have a potential for low back pain. So then I would have given you some specific core strengthening exercises that will help eliminate the chance of getting low back pain. And I would have done some assessments of some weak muscles that you might have, giving you some specific exercises, giving you books on mindfulness, and different things, making sure your sleep hygiene was good. Maybe even a tiny bit of melatonin has been shown to be very antidepressant for some people.
I hadn't heard
And
that one.
yeah, and maybe look at your cortisol levels, maybe even look at your neurotransmitters. Maybe there is a production of serotonin issue, which is coming from the gut, or so that's just a brief, and then some supplements that we know are antidepressant. SAMe, as I mentioned. Doing my blood work, I do a very comprehensive laboratory analysis through LabCorp, through Professional Co-op, and I've come up with this big panel that I basically give everybody, all new patients. It's a requirement because it's like my crystal ball. I get to see what's really happening. And it includes the CBC, obviously CMP, CMP24. We look at cholesterol. We look at iron and ferritin, and we look at GGT, and we look at homocysteine and CRP and ESR and some other inflammatory markers. We look at thyroid and free T3, free T4. We look at thyroid antibodies. We look at reverse T3, so very comprehensive. Thyroid. We look at some autoimmune markers like ANA and rheumatoid factor because it's so common. We look at fibrinogen because that's a good marker sometimes of cardiovascular health and overall inflammation. And a urinalysis with microscopic, so you can catch hidden UTIs. And all of this is just $265.
That's incredible.
To the doctor. and that's, there are ways that we, this is what I've done for 15, 20 years, that, we try to make this as affordable as possible to patients. And, if anyone's interested, you can go to professionalcoop.com or Google that. And there's some good educational videos that I've done for them, and that they have, they've got a good resource page. And you can also, email me. You can go to my website, drbrandonlundell.com, or and you can email me too some questions. I can show you how to get set up on that. But those are, if maybe we would have seen that your homocysteine was elevated, and right then and there, I would have seen that your methylation might have been impaired, and that's a big trigger, potential trigger for, depression. And so the nice thing about functional medicine too is whatever symptom you get addressed, the side effect is that your whole body gets healthy, right? With a drug, it's addressing a symptom, but the rest of your body tends to suffer. It might be hard on the liver, it might be hard on the kidney, it might be hard on the brain. But that's what's great about functional medicine, that it's preventative in so many ways. And so it's really cool to be able to go and say, well, I've got depressive symptoms, and then we treat that through the functional medicine model, and lo and behold, doing all that, you now have lower risk for cardiovascular disease. You now have lower risk for colon cancer. You now have lower risk for Alzheimer's and dementia. Like, what other model does that? I mean, it's incredible.
Yeah, instead of shifting the risk from one area to another, you're really taking all systems up and elevating everything at the same time. Makes a lot more sense to me.
Yeah.
Let's chat more about your blood work panel. That was one of the things that. So when you came to that convention, I wasn't there to hear you speak, but after you started, I was incredibly curious, and I ended up with 3 pages of notes, detailed notes myself. And one of the things that really caught my attention was your emphasis on the blood work, but not only your emphasis, it was your understanding of all the different markers and how they all relate, and your ability to, it reminds me of the Matrix, when in the Matrix, the movie, they're looking at this code, and you really can't, they can't see anything, but they can see a bigger picture behind the code. That was kind of how the blood work panel came off to me. Is for me, it's just a bunch of numbers and a bunch of, CMP, CBC. I mean, like a whole bunch of different things that, okay, that's great. For you, it's actually, it's almost a map to say, this is what is going on in your body. So describe more about that panel, how you came up with that, and some of the things that you can learn from that.
Yeah. Like I said early on, blood chemistry became my passion. Interestingly enough, in school, like it wasn't all that interesting of a class, but I still enjoyed it. And then once I graduated and started taking classes in blood chemistry that correlated, what blood chemistry means in relation to nutrition level, and in relation to, symptoms and gut and diet. And then it really became an aha moment for me. And so I've written a blood chemistry textbook, reference manual, and you can purchase that on my website again. And it's just a holistic blood chemistry manual. It's been 10 years in the making. It's got all the components that I just listed. It's my whole panel, and I go into what each analyte is. And there's a quote in the textbook of clinical and laboratory medicine that I learned from in school. And this quote always stuck with me because it's how I learned. And the quote was, "An understanding of blood chemistry can only be had by thoroughly understanding what each analyte is and the factors that control it." And what that means is that let's take BUN, for instance, or blood urea nitrogen. Okay, just a random one. Blood urea nitrogen. How we learn in school is that, and this is it, okay, this is all we get in school, that if it's high, it's a kidney marker. Okay, next question, right? That's it. That's essentially all we get about blood chemistry and with each analyte. It's a diagnostic marker. It's not, it hasn't taught us, that we weren't taught how to interpret it through understanding the biochemistry behind it. So you have to go into that more, and that's what I do in my reference manual. So what is BUN? It's blood urea nitrogen. Where does it come from? It comes from the liver, and it's a byproduct of protein metabolism, and the microbiome influences it. And if it's elevated, then yes, it can be a marker of kidney dysfunction. But if it's low, it can also be a marker of not enough protein or protein wasting. And so you look at all the markers and you look at what that analyte is, and you make a diagnosis from that. And unfortunately, on the flip side, is a lot of blood chemistry manuals or a lot of blood chemistry classes out there that are more on the natural side only teach you what supplements to give somebody. Like if BUN is high, what supplements do you give someone? That is the worst way to learn blood chemistry, because it never teaches you fully. It's just a Western medicine model, right? Using supplements instead of drugs. But the true functional medicine model is understanding the biochemistry behind it. So you get to think critically, and I teach people to think critically. If it's truly to make the right diagnosis first, if it's truly a kidney problem, then you're also going to see other things, and I tell you which other analytes to look at for each diagnosis. So if you suspect kidney problem, well, you got to look at creatinine. You have to look at potassium. You have to look at other markers to make sure that you're making the right diagnosis. And it is absolutely amazing. That blood panel essentially tells me 90% of the problem that people, are experiencing.
Wow. So
There's
you're
limitations.
seeing a very high level of success with that in terms of what you're able to diagnose.
It's the starting point. It's the absolute essential starting point. If you start going into all these fancy blood chemistry and methylation and SNP testing and organic acid testing and amino acid, all that's great. But I've done functional medicine consulting, so other doctors out there that might be not getting some results or just needing some help, and I see that a lot of practitioners are missing this fundamental diagnostic piece of blood chemistry, or they learned it from that not so great model of if this analyte is high, give them these supplements, and if this analyte's low, give them these supplements. Now, you still are going to be able to help patients in that model, but you're not going to be a great doctor. A good doctor knows what to do, but a great doctor knows why. Why is something happening? Why does that treatment work? Why do they have that diagnosis? So yeah, that blood chemistry panel, you can use it in any LabCorp. Basically, you sign up with Professional Co-op, and I don't have any financial relationship with Professional Co-op. I do some educational videos for them, but that's it. I don't get any kickbacks on blood work. They were just kind enough to let me come up with this panel because I was tired of circling like 20 different numbers, right? So they just put all this into one or two numbers that I can circle on the requisition or click on the requisition for patients. So all of this now is in one place. And if you go to Professional Co-op, just ask them for Dr. Lundell's panels. I've got two panels. One's that initial panel, and then another one's a follow-up panel that's a little more pared down because you don't necessarily need to run everything again in that initial panel because not everything is going to be high. So so the follow-up panel is more of the base. It's still got the thyroid and CMP, lipids and all that. But then if you want to retest the ANA, you just circle that code. So so that's kind of how that works. And again, you can go to my website. I've got that blood chemistry manual and the patterns manual. So I wrote a companion manual to my blood chemistry manual called the patterns manual. And then what I teach you is if you, let's say you suspect anemia, it's important to distinguish what type of anemia. Is it hemolytic anemia? Is it iron deficiency anemia? Is it B12 anemia? Is it microcytic? Is it macrocytic? So just making a diagnosis of anemia is not good. So then I go in that manual, companion manual, you can go to, all right, I suspect that it's anemia. Then I give you, if it's iron deficiency anemia, you're going to see these 6 analytes being off, whether high or low. So then you can cross-reference that and go, nope, it's not that. Let me see about B12 deficiency. Nope, it's not that. Let me see about hemolytic. Oh, yeah, it's hemolytic anemia. So then you can truly make the right diagnosis. I mean, that is what we have to do. You're not going to be a successful doctor unless you make the right diagnosis
Mm-hmm.
and keep investigating until you get to that point. So
Is that something that,
yeah.
let's say there's a person here in Albuquerque who wants to have that blood panel done, but they want to have you analyze it. So they're not a doctor; they're more of a patient. Is that something you do
Yep.
remote as well, or is that only in
Yep.
house?
I have patients all. Yeah, I have patients in consults. Yeah, all over the world. And that's the nice thing about sort of the virtual world that we live in now. And people will watch a video of mine and contact me, and they'll listen to this podcast and they'll want to contact me. And yeah, that's I love doing that because it's such a big gap. Nobody, it's very few people have access to doctors with this kind of training. Unfortunately, hopefully that's going to change. But yeah, so just email me. Again, go to my website. Email is hhc at Dr. Brandon Lundell. So hhc at Dr. Brandon, Brandon Lundell, Lundell. And just email me your labs, and we'll set up a time to go over it. And yeah, I'll give you an analysis of what I see and what might be helpful, and then people can take that and go with it, or they can do a little bit more, and we can do a consult about their whole health picture.
Yeah, I know. So two of the doctors, the chiropractors that I work with here in Albuquerque, two of them are actually have appointments or they've already been up to see you. So
Yeah,
it's always a good
yeah,
sign when doctors themselves are saying, I need I have an issue that I want to get looked at. I'm going to see this doctor. That's a little bit of social proof there. I think that's always a positive thing.
yeah. And I always preach this too, and encourage this in my classes, that for doctors learning this, the best way to learn is to run this on yourself and
Mm-hmm.
on your family. Low risk, right?
Yep.
And look, being a doctor, I mean, like a lot of professions, but particularly being a doctor and anybody in the health field, our burnout rate is really high. I mean, it's a high stress job for a lot of people. We tend to love what we do. It sometimes gets us into trouble, and we work longer hours than we should. And so, yeah, doctors as a group need a lot of help. And so, yeah, I enjoy every time I teach. There's usually a couple doctors that become patients. So, and to me, that's great. And they actually are the ones that end up becoming some of the best functional medicine doctors, because
Mm-hmm.
they're learning it through their own health, and it becomes real, right?
Yeah.
Like
Very
it's
personal.
real. And then yeah, and then they get to see the results, and then they're like, wow, this really does work. This is great.
I love that. I think that's a wonderful thing, and that's great in terms of where we're at in terms of I keep saying in terms with technology. Technology has brought us to a place that before we, for there was a lot of limited access to truly qualified professionals, but now with online access, we have really a wealth of information. There's more information now than there ever has been before, but then you also have
Yeah.
access to people who are far smarter than you in a different, broad spectrum of areas. And so it's great to be able to connect in that way. I'm not a huge fan of social media, although I own a marketing agency. I think it's fantastic for marketing. I think it's terrible for
Yeah.
us as people. Um,
Yeah, I know. Isn't that the catch-22? I mean, it's really an unfortunate dichotomy. How do we use it? But man, you're right. It is so it's not good for our psychology,
no,
right?
no,
I
it's
mean,
terrible. Isolating. Very ironically,
yeah,
social media is very isolating.
it is. And we forget how to truly connect, and then it becomes, you know, people become full of anxiety. I mean, they're comparing themselves. They're feeling, fear of missing out on everything. I mean, it's, we need people to, spending more time, breathing, meditating, pulling in, and then developing positive relationships from that place. So, yeah, but you're right. Social media can be very helpful for, connecting with people and getting information and getting help. And that it's a problem though. There's so much information out there that there's always going to be a need for professionals to help sort it out. I mean, you can't really diagnose and treat yourself. I mean, you can watch 100 YouTube videos and you're still only scratching the surface. And you do need somebody who has been doing this for a long time, who knows where to look, who knows, I mean, the treatment, like I said, with the three-legged stool, and this is true for, like, let's say you're going to try some supplements, okay? Let's say you're going to try curcumin or resveratrol for anti-inflammatory. You've got a rheumatoid condition or something, or you've got joint pain. And there's a lot that you can read, but you're missing that three-legged stool. Supplements are only going to work if your diet is where it should be. You can't make up a bad diet with a ton of supplements. I mean, it's going to help, and you can't make up a bad diet. Often people have two out of the three legs. Like, I'll eat really well and I'll take supplements, but I'm not going to exercise. I can't do it. Or I'll exercise and I'll eat well, but I can't swallow supplements. So you have to look at both the whole treatment plan, and you also have to look at dosages. So the analogy that I use is, if you're going to use a therapy, it has to be used in sufficient amounts in order to actually, make a change. So I use the boiling water analogy. So if you're going for that therapeutic change from, water from a liquid to a gas, right? That's the transformation that happens. That only happens with sufficient input of heat. The water has to be, 212 degrees, right? At sea level. So if you're just taking one or two supplements, and they're not very good supplements, something that you got on Amazon or something, then chances are you're not going to get the benefit. And so what I do in my classes and in my practice is we really look at therapeutic levels. And usually how that's extrapolated. So if it's a human study, we've got good, human data there. If it's an animal study, we'll have to extrapolate kilograms per or milligrams per kilogram of, resveratrol or curcumin or green tea extract or grapeseed extract, whatever it is. And I often find that most people aren't taking anywhere close to what we call therapeutic dosages. And so curcumin, as an example, and by the way, curcumin's been around for a long time. Everybody has like the most absorbable, you have to take it with black pepper, or you have to do this, or you have to do that. And everybody's got, let me tell you something.
You have to stand on one foot, hold your left hand up and do the hokey pokey.
Yeah. I mean, ours is, complex, with the best. It's the most absorbable. It's the highest, ours is 300% more absorbable. So if you look at those studies, because I actually read the studies, the whole study. So they're having people take curcumin by itself, okay, on an empty stomach. And then they'll compare taking their, curcumin, which has phosphatidylcholine usually in it, which is an emulsifier, on an empty stomach. Well, first of all, you need to know which supplements you should take with fat in a meal and which you should take on an empty stomach. And I'm going to, at some point, do a YouTube video on that, because the timing is just as important as dosages. So they're very misleading. And, nutraceutical companies are just as guilty of that as pharmaceutical companies. It's manipulating data in a very deceptive way, unfortunately. I mean, ultimately, they're a company trying to make money. But as a doctor, you need to sift through that stuff. So curcumin should never be taken on an empty stomach. And in fact, in traditional cultures, how do they cook turmeric? They cook it in oil because that is the only way. It's a fat soluble nutrient, and to take a fat soluble nutrient on an empty stomach essentially goes right through you.
Mm.
So it's very misleading to say, hey, take curcumin on an empty stomach and then take ours on an empty stomach, which already has fat in it. It's the phosphatidylcholine, and it's already emulsified.
So all you're
That's
doing is
completely
activating
misleading.
it at that. Yeah, that's very sketchy.
So if you just took curcumin with a meal, with a fatty meal, the absorption rates would be very similar. Now, so then you're not, you don't have to buy the next designer, curcumin supplement. So all curcumin, whether complexed or not, whether with black pepper or not, again, all those studies were done on an empty stomach. And then people would eat 4 hours later or an hour later, which is too late. So, and then they'd have them eat like a bagel and cream cheese. Like, it's funny how these studies are designed. It's pretty funny. So I have all my patients, I make sure that they take their curcumin turmeric supplements with a good amount of fat, and at least with a meal.
And it can actually be dangerous to under supplement certain things, right? Or at least counterproductive. I think vitamin C was one of the ones that you would give a reference to on that.
Yeah. So there's a lot of things that have what we call biphasic activity. So they have one or multiphasic, meaning that they have different physiological, outcomes and effects based on different levels. So yeah, vitamin C in small amounts that you can take orally. Let's say for cancer, can potentially be, if you do have cancer already, it can be somewhat protective of the cancer. But if you're doing vitamin C in very high amounts, like an IV vitamin C, it becomes oxidative and chemotherapeutic at that point. And same thing with turmeric. A small amount of turmeric and curcumin can actually protect the cancer cells, which is what you don't want. You need to take a massive amount if you're dealing with that kind of thing. But even in terms of its inflammatory effect, there's kind of a multiphasic. Like a low amount is pretty anti-inflammatory. Medium amount, I usually do somewhere around 25 milligrams per kilogram minimum with my curcumin and some of the other supplements. And again, at high amounts, it can become, pro-inflammatory. So,
so you end up with
the
reverse effect of what you're trying to solve.
Yeah. You can be counterproductive too with supplements that might be counterproductive. And I always like to use, different, if I'm trying to treat different things, like let's say, it's insulin resistance or diabetes, I'm gonna look at the research to see, well, what nutraceuticals have the best evidence for that. There's a lot of them, but for that, it's lipoic acid, resveratrol, and grapeseed extract is very effective. And so, yeah, you can't just. I've treated thousands and thousands of patients over the years, and I can tell you beyond any shadow of a doubt that I've never treated two people exactly the same.
Mm-hmm.
I've never put two people on the same things. I've never gave them the same diagnosis, and and everyone's unique, and they all have different factors that need to be addressed. Now, yes, there's common themes that are repeated, and the anti-inflammatory diet is needed, and diet and exercise and lifestyle, all that needs to be addressed in some form or another. But never two people have been treated the same by me.
That's a huge issue right now, I think, in terms of the way that we diagnose diets, the way that we try and be prescriptive in the lifestyle that people should do. For some people, running might be a terrible, terrible thing for their body. And for other people, it might be a great thing. Maybe you have bad knees and your doctor's saying you need to get out and run more. Well, that's not necessarily the best best path for them, and it's painful, and they're not going to do it for very long. So what about swimming?
Yep.
What about something else that they can actually enjoy and they can do? And that's the same. I think with diets a lot is the same thing where there's people I tend to like for myself. I like a keto diet because I feel good on a keto diet. I don't have that crash. It works well for my body. For my wife,
Yep.
it gives her massive headaches. She's
Yep.
moody. It's not a good thing for her. Instead, there's other things that work better for her. So if we go with that
Yeah.
one um, one method fits all kind of approach, one size fits all, I don't think that's very effective.
Yeah, and functional medicine is no different. I mean, it's human nature to have success with something and then kind of just over apply that to everybody.
That's
But you're
good.
right. You're thinking like a doctor now. You've got to individualize it because with every patient you're dealing with. I deal with moral and ethical preferences.
Oh, sure.
Whether they want to be vegetarian and vegan. Just money. Money issues. What's going to be more effective. In terms of money and ultimately what works for them. And there's actually, I mean, you know, blood type for your diet and things like that. There's not a ton of scientific evidence for that. Uh, some people really, like that. And what I usually notice though is that whatever diet you choose, I mean, all of the blood type diets are fairly healthy and usually healthier than people are eating. And so, of course, you're going to feel better and think, oh, yeah, I'm an O, so I need to eat a lot of meat. I think there's some evidence to that. I mean, I think that there is something to that. And I think it's sometimes helpful to keep that in mind. But essentially, you have to look at most of what works for us in diet has more to do with our psychology and culture and practicality and what we have been eating. What I do to individualize it as well is I run a food sensitivity panel on everybody. Um, it's one of the most common tests that I run, and it's an IgG, an IgG4 food panel. You can also do IgA and IgE, but those aren't as usually clinically relevant unless you're dealing with specific symptoms. But the IgG, IgG4, we look at about 150 different foods, and that helps us also narrow which foods might be irritating to the gut lining. And look, ultimately, if you have a healthy gut, why as omnivores do we have every type of specialized diet on the planet, right? I mean, there's carnivore diet that's just meat, and they
Mm-hmm.
think vegetables will kill you. And then there's vegetarian diets and vegan diets and keto diets and Mediterranean diets. And what I can tell you is that people who have a lot of severe dietary restrictions, it's usually because ultimately their gut health has never been fully addressed. A functioning gut, when you restore a gut to its full health and functioning and enough of the hydrochloric acid and enzymes and the leaky gut's resolved and the microbiome is normal again, which is a huge task for most people for sure. But ultimately that's the goal because we are omnivores and we do a healthy functioning gut can pretty much eat anything and be healthy to a certain extent. The cornerstone of my anti-inflammatory diet, though, is removing the things that we know do damage to everybody because it's just a human condition.
Like
So sugar,
sugar.
excess
Yep.
sugar, dairy, dairy, and because of all the chemicals in dairy and all that stuff, and that's a tough one with ketogenic diets, but there's ways to do it without all the dairy. So gluten, dairy, and sugar for most people. But again, once the gut's healthy, you can have some of that in reason and be okay. Because I've eaten this way for 20 years and, I'm fortunate enough to, when I was young, to kind of get on this path. I can eat a little dairy. I can eat a little gluten. I can eat, the one thing that I don't do is refined sugar, like maybe, just very rarely. because that I believe is absolutely, it's not a food. It's, it's just something that is, it's a drug, and it's an addictive substance, and it has so many detrimental effects.
Yeah,
But
if you give sugar to a baby who has not developed a tolerance for it, it can actually it has pain relieving properties as well. So I mean,
hmm
it's a very powerful drug
it's a
that I
drug.
think we give not enough credit to for sure. Instead, we give it away
Yeah.
freely to kids, and some parents don't even restrict it. Mine was very much like that. If I could get sugar, I could eat it. That's how my mom kind of
Yeah.
approached that, which is just
Yeah.
it's terrible.
Yeah. Well, me too. I grew up, man. I would get a $2 a week allowance, and I grew up next to like this amusement park place that I could walk to, and right on the foothills and the mountains in Golden, Colorado, and I would go to this specialty shop, confection shop called Ida's Fine Candies, and I would get a pound of gummy bears for
Oh
99 cents,
no.
man. And by the time I was 12, I had significant health issues. Like I had these sores in my mouth, which they never figured out what it was. But looking back now, I know what it was, and it was stress and too much sugar in the diet. And so, yeah, I mean, it's amazing at what our bodies can tolerate, but up to a point. And
Yeah.
yeah, and so sugar is one in all the studies that is the most damaging. The other thing that's really important that people forget is it's not just what you eat, but it's also timing and amounts.
Hmm.
Now, those are equally as important as what you eat. And also understanding that ketogenic diets and paleo diets and, whatever diet you're on, they all create a unique nutrition signature in the body. So, for instance, paleo diets and ketogenic diets, it can induce a mineral deficiency, specifically iodine and selenium and trace minerals, because you're not getting that in your diet. The only way to get trace minerals is with seaweed, seafood, and a lot of vegetables. So vegetables do need to be the cornerstone of every healthy diet, and that whether you're keto, whether you're paleo, vegetables do need to be there, and every study is very clear on that. Um, the carnivores are the only ones that I think are truly anti-veg. I've read blogs about people saying, broccoli is, going to kill you and it's the worst thing for you because it's got sulforaphane in it, it's crazy what's out there. But yeah, in timing, I always, one of the first books I read on diet was called The 120-Year Diet. It's written by Ron Wolford, who is a DO, did a lot of research, and essentially the number one predictor of longevity and health is calorie consumption.
Hmm.
It's not just what type of calories, but no matter what type. And yes, doing the keto is certainly more healthy in terms of being able to burn fat and not having the blood sugar issues. But in all animals that he studied everything from flies up to humans and our closest genetic cousins, which are rhesus monkeys, and they actually did an entire longitudinal study for 25, 30 years, which is the lifespan of rhesus monkeys, and seeing, okay, well, if we restricted timing, even if they got the same exact food, if we restrict timing and calories, the group that got the restricted diet, they weren't starving by any means. They just were only fed twice a day, and they got a limited number of calories or a set number of calories versus the genetically identical twins who were able to feed unrestricted throughout their lifetime. And sure enough, like every study ever done shows that it increases longevity. And that's where intermittent fasting is so important in triggering what we call autophagy and mitophagy. And that's why I like understanding the biochemical principles. What happens in our genetics? What happens in our RNA and microRNA when we're fasting? And I often tell my patients the healthiest feeling you can feel in your body is hunger.
Hmm.
Hunger triggers so many positive hormonal changes. I'm not saying starving yourself, but like if you feel hungry, just chill out with it. Like be okay with it. Like that's a good feeling, and be with it for a while because we need to trigger glucagon. We need to trigger gluconeogenesis in the liver in order to have a healthy liver, have healthy blood sugar, and in order to get to ketosis. Ultimately, true ketosis is, triggering gluconeogenesis in the liver, and really the thing that determines that is the amount of calories that are available in any given moment. So yeah, what to eat and is just as important as when and how much.
Yeah.
So I've seen very unhealthy people on paleo diets. I mean, which can be a very healthy diet. Protein and vegetables are very good for you in many ways, but if you eat too much of it, it's not good. And ketogenic diets do increase triglycerides and lipids, and you do have to be careful about that. Cholesterol isn't the only issue, and triglycerides aren't the only issue with cardiovascular disease and things, but it is important, and especially with fatty liver and the increase in fatty liver disease. So yeah, there's ways to do it, and I don't think that you just have to know again what supplements to take to supplement each particular diet.
Yeah. It seems like there's three common factors that are widely accepted no matter what side of the fence you're on in terms of diet argument. And I think pretty much everyone agrees that refined sugars are a bad thing.
Yep.
Eating fat and sugar together is even worse because the combination of those results in not good stuff. And intermittent fasting has a lot of health benefits, even beyond both to weight loss, but also to health benefits. I think that's a thing that a lot of people don't understand too, is there's a lot of things that you can, a lot of things that you can do to lose weight, but they aren't necessarily healthy. And there's a lot of things that you can do that are going to be very healthy for you, but they're not really going to lead to weight loss. And those two objectives are very separate, and they've got to be kept both in mind as you're progressing through it.
Yeah, and so as an example, a ketogenic diet and a paleo diet, whenever you restrict, and I would go one step further, like refined sugars, but also excess carbohydrates. I think everyone agrees that refined carbohydrates are not good for you. However, studies do show that a low carbohydrate diet over the course of your entire lifetime is not good either. We do need good quality carbohydrates. But so as an example, ketogenic and paleo diets, and I've gleaned this from running thousands of blood works on people who have changed their diet. What we often see, and this is in the medical literature, that if you restrict your carbohydrates and calories, it will actually shut down your thyroid production, because and this could be what's going on with your wife. I see this common, and there's often some detox issues as well with how it affects the liver. But oftentimes what happens is your T3 and T4 levels will lower when you're on that paleo or ketogenic diet short term. However, there's a paradox that happens where your thyroid receptors become more sensitive, and in terms of balancing that out. But it takes about 3 months or so, 4 months for the thyroid to balance out. Sometimes 6 months. It depends on the person. So when somebody is losing weight and they're on this diet, we'll run the blood work, and I will often see TSH go up and their T3 and T4 levels go down. That doesn't necessarily mean you're inducing a hypothyroidism, because they actually are feeling really good. It just means that there's an adjustment period sometimes that needs to happen as their thyroid receptors come back, their hypothalamus and pituitary sensitivity has to adjust, and then the TSH and T3, T4 levels balance out. But just as a tidbit for the practitioners out there, patients who react negatively, they may need some thyroid support early on, maybe some thyroid glandulars, maybe some iodine. And that's the value of running the blood chemistry test before you start putting somebody on any kind of diet or making changes, because you will be able to see most times what their susceptibilities are. If they're already on shaky ground with their thyroid, then you better do some thyroid support while they're changing their diet, or else they're going to get headaches and nausea and then get mad at you and think natural medicine is all a bunch of crap.
Yep. Then you have the reverse. We're getting pretty short on time, but I have two more questions that I want to ask you. One, I'm
Sure.
hoping you can put to rest something that I've been pondering on and really researching recently, and that's the cholesterol, or what cholesterol does to your body. And from a couple people that I trust, authors that I trust, they have both made statements that make me feel like cholesterol might not be such a bad thing, especially for women. So, for example, Gary Taubes, he wrote a book called Why We Get Fat and What We Can Do About It. And he explains that, there was a study that happened in, I think it was the 80s, where it was a cholesterol study, and it was saying, is cholesterol bad for humans? And they were doing that. And at the same time, they had a drug study to say, will this drug reduce cholesterol? And from what I understand from his book is on the study of the drug, they said, we can't prove that cholesterol has any positive benefits on the body. So we're going to recommend that everybody take this drug to reduce the cholesterol. At the same time, we can't prove that cholesterol has any negative benefits on the body as well. So I may be misinterpreting that, but what are your thoughts on cholesterol, and specifically in women? Do you think that it's as demonized as we've made it to be?
Yeah, so a couple of things about the biochemistry of cholesterol. You have to look at the big picture of cholesterol. And a good lab for that actually is a lab called Boston Heart Labs, and they'll look at the bigger picture. So cholesterol, it's going back to the functional medicine principle of always ask why. If someone's got elevated cholesterol, why? They could be either an overproducer or an overabsorber. So it could be dietary, but it's often not dietary for most people. You have to look at your HDL and your LDL and your pattern sizes, and cholesterol in and of itself was vilified because in many ways what you were saying is that it is associated and correlated with cardiovascular disease. We haven't proven that it's causative of cardiovascular disease, okay? And a lot of this study came out, does that make sense?
Mm-hmm, yeah, because causation or correlation doesn't necessarily lead to causation.
And studies are clear. Look, I think cholesterol can be detrimental, and I'll go into exactly when and why. But it is a weak predictor. It is correlated with cardiovascular disease. A lot of people, we know plaques are made of cholesterol. And so having excess cholesterol can be a risk factor in the formation of plaques that can then produce strokes and heart attacks. However, it's never been proven that cholesterol in and of itself as a dietary component or even familial overproducing is enough to induce cardiovascular disease. In fact, that's where he was saying no study has actually ever done that. If we just fed mice cholesterol, that in and of itself is not enough to induce cardiovascular disease. But mice with cardiovascular disease have elevated cholesterol. So how do we induce cardiovascular disease? We actually induce cardiovascular disease in animals and humans, again, through multiple inflammatory mechanisms. The inflammation is what needs to be there as the precursor to make cholesterol a problem, because you have to have what we call oxidized cholesterol. in order for it to be attracted to the cell wall of the artery. You also have to have injury to the artery, and it's the injury to the artery that starts the plaque process. So how do we get injuries to the artery? Through oxidation, not enough, antioxidants, not enough glutathione, free radicals in the diet, sugar. What is the backbone of cholesterol? And I
That's
always, the,
yeah,
the
beyond
backbone
me.
of cholesterol is actually sugar.
Okay.
So sugar, so the backbone of cholesterol is actually called a triglyceride, or actually a very low density, or VLDL lipoprotein, but it's actually three glucose molecules wrapped in an ester alcohol, and that's what we call, and then there's some protein in there, so it can become water soluble, and that's what increases triglycerides and cholesterol. It's sugar in the diet, and sugar, and they've known this since the 50s, and there's other authors that say that they knew that sugar was the number one cause of heart disease, but the sugar industry was so big, and there was no fat industry back then, and so, and then again they did find a drug that lowered cholesterol, so that became an overemphasized target because there was a therapeutic outcome, and a pot of gold at the end of that rainbow. So yes, cholesterol has become, what I always say is, yes, cholesterol is an issue. It's not benign, but there's other things that need to be there for cholesterol to be a problem. And when we put people on statin drugs, we actually know that it increases their chance for developing other diseases. So we're pretty much just trading one for the other. Why? Because it's not asking why. Why does someone have elevated cholesterol and cardiovascular disease? It's not a deficiency of a statin drug. And, right? And so the statins, actually, we know it's called the statin diabetes conundrum, where the longer you're on statins, the more it induces diabetes, which is then the number one cause and contributor to cardiovascular disease and high cholesterol. So it's just an interesting dichotomy. So you have to have all these different factors of lower glutathione status, not enough exercise, you're not getting the blood flowing, nitric oxide system gets impaired, the arteries become damaged and brittle and hard and weak, and then cholesterol is just there, to help fill in the gap. But if you do have excess cholesterol and those other factors, then you really are a setup. So in those cases, just lowering cholesterol, it does help with some instances of cardiovascular disease. I mean, I'm not stupid. I mean, there's enough evidence that does show that. But it's literally like trying to dam up, the Mississippi at the mouth of the Gulf, instead of up in Minnesota where it starts. Like, it's silly because it's very weak. And evidence of that is the fact that cardiovascular disease continues to rise and be the number one killer despite 50 years of statin medicine, right? So, come on. So then we ask, what are the positive benefits of cholesterol? What is cholesterol as a biochemical molecule, right? The body never produces something that's unnecessary, even homocysteine, which is actually 5 times more predictive of cardiovascular disease. Why doesn't everybody get their H score tested or their homocysteine tested? Because cardiovascular surgeons would lose a ton of money, cardiologists would lose a lot of money, and there's only a supplement that lowers homocysteine. Homocysteine can only be lowered through B12, folate, B6, magnesium, zinc, and other cofactors. That's the only thing that will ever lower homocysteine. So that will never, even though it is in the Framingham Heart Study, it is far more predictive and far more protective when you do lower homocysteine. And that's a whole nother story. And I go into that in all of my classes, which if we have time, I can go into that in just a minute. But then we look at what cholesterol is, and cholesterol is needed for our brain. It's needed for myelin sheath. It's needed for steroid hormone production, which is why you're alluding to the fact that it's maybe more important for females because they do produce more hormones than males, more estrogens and more cortisol typically. And so all of our hormones are steroid based, or all of our steroid hormones are cholesterol based. And when you start lowering cholesterol, then you start inducing testosterone deficiencies and estrogen deficiencies, and then people, and this is repeated so many times where middle-aged guys put on a statin drug and then develops low testosterone, and the doctor is clueless that it's the statin drug that induced it, and other things too. I mean, the same factors that cause high cholesterol cause low testosterone, which is inflammation, back up in the arteries, not enough nitric oxide, the testes start to shrink, all of those factors.
Yeah, and then you start ending up with all these other symptoms where you're saying I'm lethargic, I'm gaining weight, I don't have the energy that I used to, I'm moody, and it's actually those aren't issues, those are symptoms of other real true issues.
It's right. Always ask why. Why does somebody have high cholesterol? So the other issue with cholesterol is the fact that it is partly how the liver regulates its inflammation and toxicity. So LDL is trying to take toxins, an overload of toxins from the liver out into the bloodstream because the liver can't handle it. The liver's inflamed, the liver's overwhelmed. The Kupffer cells literally upregulate the HMG-CoA reductase enzyme in response to inflammation and in response to leaky gut and toxins. And there's actually this whole really cool, exciting area of research called the gut-heart connection of how leaky gut and the microbiome are contributing to cardiovascular disease, and ultimately it is because of how its effect on the liver. So as LDL increases, that's a sign that the liver is dysfunctioning. And so what needs to happen is the antioxidants, glutathione, milk thistle, N-acetylcysteine, things that help support the liver then to lower the cholesterol and make the antioxidants and deal with the sources of toxicity and the buildup of toxicity that's happened in the liver, and to support proper liver function. And HDL is produced in response to Kupffer cells saying, we can actually process more toxins now. We're feeling better. So yes, it's somewhat genetically driven, but it's also what happens to the liver through diet and lifestyle and things like that. So that's my cholesterol spiel in a nutshell. I mean, it's there's a lot more to it, but that's essentially how we treat cardiovascular disease. And we also need to support the mitochondria in the liver, and we do that through lipoic acid and acetyl L-carnitine and grapeseed extract and green tea extract and again, intermittent fasting. There's so many tools that we have that when someone says, well, diet and exercise wasn't enough, it's just because actually, speaking of one of the heart doctors, it's not Barry Sears. What's his name? Love Medicine. Bernie Siegel, who wrote Love, Medicine, and Miracles, and he talked about cardiovascular disease and the psychology of that, and he said that diet and exercise and their supplementation, any therapy, is a dose response curve. It all responds on a dose response curve. And I always remind patients of that if they're not getting the results, it's typically because their dose, their dose of exercise, their dose of dietary changes, their dose of the supplements that they're willing to take is usually not sufficient. So that's a good place to kind of maybe end this session with just that tidbit there, because it's so true in anything that we do.
Yeah, that makes sense. Well, we're
So
we're about 10 minutes over on our time, so I want to be respectful of your time. I would like to ask one more question on kava. Do you have just a few more minutes to share?
sure,
Okay, so
sure, I got a couple more minutes, and yeah.
you had mentioned in your seminar that you really like kava and you like the benefits of that. So I went out and bought some. I bought this little strainer bag and I bought this pound of dirt, basically, is what it, and mixed it
Yeah,
all
yep,
up and did a little bit of research on it. So I found out that you got to add a fat of some sort. So I added some. What was it? I think I'm not a fan of soy in general, but it was like a
right.
soy fat, basically.
Lecithin.
Yeah, that's it. Lecithin.
Yeah.
And it really tastes like dirt, makes your mouth numb, and it does seem to have a calming effect. Is that the way that you do kava?
Well, I do kava in a supplement. I let other people, I let other, manufacturers do the extract. Most of it's water extracted. There's CO2 extract as well, which can be a little bit more powerful. But yeah, the kava lactones are what make your mouth kind of go numb. So that's a good indicator that you're doing it right. If it makes your mouth go numb, and and kava has been used for thousands of years. It's probably the most studied herb for anxiety and generalized anxiety conditions and stress, and its safety actually was called into question in the late 90s. It was actually found out that pharmaceutical companies falsified and overemphasized those studies because it was, quite frankly, eating into their profit. The German Supreme Court actually berated, found, exonerated kava, and said, based on all the evidence, kava is not only safe, and it is effective, and the drug companies, were fined millions of dollars because, as the German courts put it, they kept people from getting the right therapy, and they put people in harm's way by giving them the drugs with known, detrimental side effect profiles. And so, the long and short of it is not everybody needs kava, obviously, but yes, kava is very helpful. There's never been a study to date that has shown kava to have any more liver damaging effect than any other herb. In fact, they did studies looking at milk thistle and St. John's wort, and kava had the least, least effect on the liver of all the ones they studied. And so, unfortunately, it just got a bad rap, and so people are still cautious about it. But it is, the FDA only took it off the market for about 6 months, and even their research was like, no, it's fine, it's safe, we can put it back on the market. But the drug companies, and the people who maybe just, I don't want to just single out drug companies, probably other groups, other people,
Obvious.
and maybe they have some kind of altruistic, thing. They're trying to protect the public, but it's misinformation, and then they know that once the reputation is damaged, it's can be very difficult to change that. So I go into a lot of this information, both in blood chemistry and what nutraceuticals work and how they work. So I've developed a whole functional medicine, nutritional pathology course. It's 6 modules. And again, I've been to just about every seminar and training program out there. And what I've done is I've distilled it into what you really need to know as a practitioner. And I've had patients take it too, because they get so into this and they want to help their family. And I really go into how to think like a doctor, how to make the right diagnosis, what tests do we want to run, how to apply that 3-legged stool to each patient. So if you go to my website, you can go to courses, and you can buy each module is a standalone module. The first module goes into blood chemistry and inflammation and methylation. The second module goes into autoimmune and immunology. The third module is all gastroenterology and how to support that. And the fourth and fifth module are the whole hormone system, adrenals, thyroid, sex hormones, all of that. And I go into detoxification. The sixth module is kind of cardiovascular, metabolism, energy regulation, and a lot of case studies, putting it all together. So I've got my anti-inflammatory diet in there. I've got a resource kit that I've put together that is, every article that I've read, and I've read thousands and thousands and thousands of them, that I think is clinically relevant, I've actually put that in my functional medicine resource kit. So it's a searchable database. So if you go into autism, or if you go into diabetes, or if you go into cholesterol, all the research articles that I feel are really good and clinically relevant come up. I mean, it can save practitioners thousands of hours of research, and because I've already done it. It's got all of my protocols. So, I've got protocols from everything from bee stings to toenail fungus to sinuses, pre and post surgery, cholesterol, cardiovascular disease. I've developed, viruses, West Nile, herpes. I've got all kinds of protocols of what somebody needs to do with supplements and how much and all that kind of stuff. So, and then my blood chemistry manual and pattern guide. So all of that's on my website, and it's available for people. And I've put a lot of time and energy and money into it because, I love what we do, right? And this is so important. And so, I'm very grateful to you, Charles, for letting me, speak to your sphere of influence and hopefully help people in their journey as well.
Absolutely. Yeah. Pleasure for me as well. Isaac Newton one time they asked him, you were able to accomplish a lot of great things in your lifetime. How were you able to do so many things? He said, I did it by standing on the shoulders of giants. And that's a quote that I've mentioned here on the podcast before, but that's exactly what you're allowing other people to do through your courses and through your learning. You've taken your passion, your education, you've kind of tried to put that into a place where now you can pass that information on to other people. And as you're still learning yourself and growing, but allowing other people to take that and essentially stand on your shoulders so that they don't have to go through all that same learning process, and then they can use their time more effectively to do the same thing that you're doing, which is, give other people a leg up. So I think that's fantastic, and I hope that more people take advantage of that, and that grows from this as well.
Yeah, and I mean, believe me, I stand on the shoulders of giants too. Like, I've learned from a lot of really, brilliant people, and there's so many people. That's why one of the things that the only thing that really gets me worked up these days is when somebody says, blindly, oh, there's no scientific evidence behind functional medicine. And, oh my gosh, there is so many people doing this. There's so many researchers and environmental medicine and there's so much evidence behind this that it's just ridiculous to say that there's no scientific evidence. There's more scientific evidence behind this than ultimately there is in Western medicine. And actually a good book that kind of highlights that. It's an older book, about 10, 15 years old, but it's a great book called What Your Doctor Doesn't Know About Nutritional Medicine May Be Killing You. It's actually really just kind of highlights. It's written by a medical doctor. And then I'd like to leave this session with just a quote too that I really like, by Michelangelo. And he said that if people knew how hard I've had to work for my mastery, it wouldn't seem like mastery at all. And, that's, people ask me, how'd you get, like they'd say, how did you get all this information? You're so smart. Like, I don't think of myself as that smart. It's just putting in the time to get the information and knowing where to go. And that's, again, what I've tried to do with my courses. So hopefully that can help people cut a lot of that time out to gain their mastery. And so
very cool.
So Yeah, that's kind of a good quote,
Well,
and
one
I
more.
look forward to doing more with you. Yeah.
Awesome. Me too. Yeah, for sure. And I definitely want to do a follow-up podcast. I have a billion other questions to ask you as well. So
Okay,
we'll have to
great.
do a follow-up. Before we wrap up though, so let's go over it one more time. How can people get a hold of you? Your website is drbrandonlundell.com.
Yep, drbrandonlundell.com, brandonlundell.com, and you can email me through there. You can either contact me through there or just email me at hhc@drbrandonlundell.com. And if you go to my website, you'll see a place to go for practitioners or for prospective patients, and you can go to my courses over there. And it's like I said, each module is about 15 hours, 12 to 15 hours, and there's 6 modules. So it's a very thorough training course, and you just go at your own pace. And I'm available to questions as you go through it. It's a mix of audio and video, and lots of notes, lots of resources that I give you with each module. If anybody's interested, they can contact me there.
Okay. And then what's the name of your practice in Colorado?
Yeah, it's Harmony Healing Center.
Okay. Harmony Healing Center. Okay. Yeah, just so
Yep.
that people can get a hold of you in a multiple different ways. Google Maps is a fantastic way to find the clinic, and lots of great resources.
Yep, it's there. Yeah, exactly.
All right. Well, hey, thanks
All
for
right.
joining me today. Such a pleasure. I learned a lot today, and I think you really are a master at your trade. I appreciate you spending some time just sharing some of that, and have an awesome day.
Yeah, thank you, Charles, and we'll see you next time.
Okay, sounds good. Thanks everyone for joining
Bye-bye.
in. Have a good day.